Hi, YouTube fam. I am Angeline, the nursing assistant. Welcome, welcome, welcome. Welcome back to Informative Friday. And if this is your first time tuning in to my channel, I welcome you. I invite you to come back every Tuesday and every Friday. On Tuesday, we come here and we do Chit Chat Tuesday, and I talk about anything from A to Z. And sometimes I throw in a blog or two. And on Informative Friday, we talk about specific educational, specific information about nursing assistant. So if you would hit that notification bell, hit that subscribe button, and come on and join the fam. So you guys, let's get into this Informative Friday. On this Informative Friday, we will be talking about how to calm down a combative patient. On one of my chit chat video, I discussed about a combative patient, the problem I had with that particular patient in trying to give him a bath. So I will link that somewhere in this video, so you guys that have not seen it, go back and take a look at it. But in saying that, I did not address how to calm down a combative patient. So on this Informative Friday, we gonna discuss how to calm down a combative patient if you run into that situation. A lot of time, you may run across a combative patient. They may be on the influence of alcohol or drugs, or sometimes they may have a mental issue. So as a nursing assistant, you will run into combative patient, agitated patient. So on that note, we need to know how to handle them and how to work with them to try to calm them down. So let's get into it. If you come by a patient, go in a patient room, and this patient is combative, irritated, or anything like that, depending on the degree of irritation that the patient is, sometimes it's best to go get a second person if the patient is violent. And also keep yourself at arm's length to the patient, because sometimes patients can get very violent and they may strike you. So keep yourself at a distance, and if all possible, if the patient is at this level, bring in someone else. Listen to the patient regardless of how nasty he or she is talking, maybe cursing you out. Do not stoop down to the patient level. Listen to him. Let him say whatever he needs to say. When the patient is talking or speaking, acknowledge what he or she is saying. Listen. Then sometimes what he's asking or what he wants you to do is unreasonable. Explain to him what you're there for and what you're going to do. And if he wants something that's out of your scope, or he tell you to do something or ask you to do something that you don't know whether you can do it or not, then you need to go and get your nurse and explain to your nurse what is going on with this particular patient. Once you have informed the nurse, most of the time the nurse will come in the room to try to see, can she calm the patient down? And then sometime the nurse may tell you to wait and give the patient time to himself, and then go back in to try to give service to this patient. Most of the time, it does work. When you go back in, the patient have calmed down and you're able to perform what you need to do for them. But a lot of time when you go back in, the patient is still violent, combative, and you can't give the service that needs to be given. At this point, remember the patient do have the right to refuse. Sometimes, it may seem like he really needed and someone should make him, but as long as the patient is in their right mind, they have the right to refuse any service, any medication, even if refusing means death. That's right. Even if refusing the service means that they will eventually die, a patient still have the right. So, on that note, I hope you guys gain some kind of information, some kind of knowledge how to try to calm down a combative or agitated patient. A lot of time, most of the time, it works, but you will have some instant where nothing can calm down this patient. Sometimes a nurse may come in, have to administer medication to a patient to get him calmed down. So sometimes you just cannot do the service for this particular patient, and that's okay. You have to not only protect your patient, but you also have to protect yourself. So you guys, that's it on this Informative Friday. Subscribe, like, and hit that notification bell because you don't want to miss not one of my videos. Not one. Come on, come on, come on. Let's get it started.